So up next is Dr. Prashant Garg to speak on technology to teach.
He's supposed to go over here. Prashant, I think we're rotating you. But they've got your slides. They have your slides though today. I hope.
Okay. So good afternoon, everyone. And I think you have already heard how technology is slowly creeping into our educational system. I do not have any financial disclosures to make, and the objectives of my talk will be to introduce you to the topic of where else and which other technologies are being used in medical education. Oops. List of available technologies, controversies around use of technology in education, and the pros and cons of technology in education. I'm sure that at least few of us who were born before 1990 have seen classrooms like this. And these were typical classrooms where teacher from the podium used to give lectures right on the blackboard and ask questions. And most of the time there are few students who are very proactive, always raise hands, yes, I can answer. But there are many who probably are sitting idle without answering the question. We have seen the change where the technology first came in primarily to project our presentation, either in the slide format or even the transparencies. We then have smart blackboards, which not only were putting drawings on the blackboard, but were also converting these into a digital format to be available for students. And I think post-COVID, we have seen that the classrooms have become almost virtual. There are no students. Teacher is sitting somewhere and the students are everywhere in the world. And we also have mixed classrooms where some of the students come to the classroom, but there are many more who are attending virtually. And we have today's session also a mixed format where we have audience here as well as there are people who are connecting virtually to this. Even in India, where people thought we are a low and mid-income countries, you will be surprised that today many of the students are learning with the laptops, iPads, and they are having virtual classrooms during COVID as well as now continuing post-COVID. So this is how the transformation has happened, and COVID in some sense has accelerated the use of technology for education, not just medical education, but different parts of. There are other systems where technology is incorporated. You can see variety of learning management system where who is enrolled in the course, how many credit hours have they done, what are their assessment scores, which courses somebody has not taken is entirely done online on different. And there are many like Moodle, Canvas, and Talent LMS kind of softwares. Then there are on-learning platforms. I think in India, we have Byju's, who is using online education system where the lectures are uploaded, people are accessing those lectures. Then the questions are sent to them and they review, they answer those questions, and then answers are already given. Virtual classroom, I already talked, and there are beautiful platforms that allow not just connectivity but also interactivity, where these can be synchronous, they can be asynchronous also, such that you can use those recorded lectures to go through them and understand what are the content and what kind of discussions happen. There are educational app, and Dr. Venkatesh Prajna talked about one of the educational app, but there are many more educational apps that are available, and they are slowly getting into the medical education as well. Dr. Karl Golnick talked about chatbot, and they are becoming more and more popular over a period of time. The artificial intelligence he has already covered, and I'll not be surprised that in future you will have guys wearing the virtual reality headset and the entire class is happening on the virtual reality headset. You will have patients who are not real, they are artificial patients, and Even the surgical training will happen on these platforms. In nutshell, I have just given you a glimpse of how technology is slowly creeping up into medical education, and we are slowly going to move away from the typical apprenticeship program into where the technology is going to enhance the overall learning experience, both for the teachers as well as for students. The virtual patients and the simulation systems are already in display, and I think if you go to the trade, you will see many of the simulation system already displayed into the stalls. Now, what it has resulted into, at one end, even in this room we saw that on one hand there are propagators of technology in medical education. At the other hand, there are groups of people who are skeptical about using technology for medical education. Let me take you through this debate of those who are propagating technology. They primarily are saying that technology is enhancing interactivity. Technology is enhancing collaboration between students, between different educational organizations. There is a lot of ease of teaching for the teachers. It also enhances the learning experience because you can use the personalized learning style and content in order to learn. And then there are many innovative contents. Prashant touched upon this point. And then you are enhancing accessibility. Good teachers are rare, but if their knowledge can be shared beyond the boundaries of their universities or medical colleges with other medical colleges, with other students, I think that will be a welcome change that each one of us will like to see. There have been studies that have documented that in comparison to no intervention, technology enhanced simulation training in health profession education is consistently associated with large effects for outcomes. In addition, we have all to realize that the next generation or the younger generation, particularly the millennials and Gen Zs, they are so tuned into using technology that if you are incorporating technology, they see some excitement, they see familiarity with the way they are learning, and therefore their adaptability to teaching becomes much, much faster. There are other advantages compared to typical apprenticeship. The learning happens in a safe environment. You can allow them to commit mistakes and then learn from that, which you cannot allow in the operating room. Typically, as soon as a student start making mistake, you tend to take over the case and try to finish that case. The student has not learned, but on the simulation, you can allow them to go through and see how are they identifying complication, how are they managing complication, and also give them a sense of what are the consequences of if this is not adequately managed. You can then also enhance their learning through the graded exposure to the difficulties and then make them good over a period of time. The other benefits of simulators are they are useful for resource depleted training program. If their patient volumes are not good, how will you allow your students to operate on the patient? Simulator can help you continue that. It's useful for human resource development, particularly in for example, there are programs where there may not be retina specialists, so they are coming for 2 days. Now, how do you give exposure of retinal surgeries to such students? Possibly some of these programs can give you. Now, many of us in the later part of our career may not see complication, and then if you suddenly end up with the PC break, now you do not know how to manage that, and you end up losing nucleus. In the simulation base, you can keep going back and upgrade your skills. On the other hand, technology is a distractor also. There have been studies that have found that if you allow people to bring mobile phone, they keep going back to check their social media posts and other things. There are other negative outcomes of the distracted learning. It is known that learning takes longer, there is mental fatigue, impaired memory, and most probably the ability to creatively think and find answer goes away because you have answers at hand. This was validated even in a WHO study where they created a working group to look into the technology too, and they found that there is little good and impartial evidence of added value. Technology lifeline for millions but exclude many more, particularly in the low income countries. And some technology can improve some type of learning in some context only. Slides are not moving. I don't know whether I have run out of time, that's why the slides are not moving. So in conclusion, our goal should be that we have to become familiar with technology, but then we also have to make an assessment as to how do you create a classroom, a course where technology is used to engage rather than distract the students. Thank you very much. I just want to have a poll that how many of you feel that you will be comfortable with the student bringing digital device in the classrooms. Okay, good, I think. Thank you very much.
Are there any questions regarding Prashant's? Yes, please use the mic.
It's more of a comment actually. One learns as one goes along. With the postgraduates, normally in the morning, what we were doing, we were having sort of asking them to prepare a lecture, and one of them would present it, and then we would discuss. And what we found was that most of the time, what they would do just in the evening, sit down, pick up a PPT from the net, come there and present it. You ask them what is 2 slides later, they won't know. You ask them what was presented 2 slides back, they won't know. So from that, the next step was we started giving them evidence-based, correct, distinct that, okay, even if you have to pick up, these are the ones which are okay. And then automatically we came to that flip kind of thing that one day in advance we gave them a PPT of whatever was to be presented, and that 1 hour in the morning then came down to a discussion. So automatically
Yeah, get them interactive and engaged. Important adult